afternoon, Congressman McCall. My name is Wendi Bolton, and I'm a nurse in Houston, Texas. Thank you for taking time out of your busy schedule to speak with me about the Registered Nurse Safe Staffing Act, House Bill 2083, Senate Bill 1132. It was introduced into the 114th Congress by Senator Jeff Merkley, Representative Lois Capps, and Representative David Joyce.
You're welcome. It's my pleasure to be able to spend a few minutes discussing important legislation with my constituents.
Congressman McCall, as you know, the State Safe Staffing Act would require Medicare participating facilities to create registered nurse staffing plans via a hospital-based committee. It would be comprised of a majority of direct care nurses. Do you feel you'll be able to support this legislation should it come to a vote?
I am somewhat familiar with the legislation, but need more information before I could genuinely agree to support it. Could you provide me with more detail about the bill?
Absolutely. The bill addresses several principles that have been substantiated in the literature and historically have been understood by nurses both past and present. These include ideas such as patient safety being directly proportionate to the number of nurses working on a staff. Suboptimal nurse staffing is linked with a greater likelihood of patient death. Nurse fatigue is a major patient hazard. Optimal nurse staffing and skill mix improves patient satisfaction and reduces adverse events. And higher nurse staffing generates cost savings to payers.
These principles seem very common sense. It's hard to argue against the idea that better nurse-to-patient ratios would lead to the delivery of better quality care and improve patient outcomes. How does this legislation affect the bottom dollar for hospitals? Will it end up costing too much?
Actually, safe staffing has actually been linked to an overall reduction in cost to healthcare facilities. These reductions in costs are a direct result of reduction in the risk of adverse patient events such as infection, bleeding, and medication errors, falls, and even hospital deaths. Also, improved staffing results in a more positive work environment for nurses. This reduces turnover and improves retention, both of which are beneficial to hospital budgets.
Can you tell me who would be joining me in my support of this bill, other than the legislators that introduced the bill?
The American Nurse Association supports the bill, as well as several hospital associations, and 7 states have already enacted safe staffing legislation used in the Registered Nurse Safe Staffing Act's committee approach. These include Oregon, Texas, Illinois, Connecticut, Ohio, Washington, and Nevada. All have reported improved patient safety and nurse satisfaction.
That is encouraging and gives me more confidence in the legislation.
Can I count on your support should this vote come to a bill in the current legislative session?
Absolutely. I feel this is an important piece of legislation and will do my part in assisting it in being signed into the law.
Thank you for your support and time, Congressman McCall.
Anytime.